Tonight, we're going to be talking about the explanation of the rationale and techniques for surgical draping, how to maintain sepsis during draping, and draping techniques of the surgical site. Surgical drapes are used to provide a wide sterile area around the surgical site. Draping is performed immediately after the skin prep and after the skin prep has dried. If we put it on right when the prep is wet, remember those vapors could be building up underneath there. And then once the bovie hits, we could spark a fire. The drapes act as a barrier surface between non-sterile and our sterile instruments and us. The center of the sterile field is defined by the position of the drapes. The incision is the center of the sterile field. So, whoops, sorry. In this picture, this would be the center of where we're going to be making our incision. Goal is to handle drapes while maintaining aseptic technique. So you got to remember that your playing field is from your neck to your abdomen. That's where your hands always need to be, neck to abdomen. They can't go above, out, or down below your waistline. Okay. Drapes are folded in a specific way before sterilization so they can be positioned over the operative site and unfolded in a way that prevents their contamination. The orientation of the drape as it is first placed over the incision site is critical. And once we position that drape and we lay it down the patient, that's where it has to stay. We can't shuffle it. We can't move it. Where we lay it is where it stays. Here are some pictures of some drapes. So this is non-woven drapes. They're single use. You throw them away after the case. Made from spun synthetic polymers, impervious or semi-impervious to moisture. That means water won't penetrate it. Blood shouldn't penetrate it, won't penetrate it. These white areas are the stickers where we would peel them off and then place them over our incision site. So our incision site here would be in the middle somewhere, and same with this. And then this is a big square, so somewhere in here would be our incision site. This guy here is a woven cloth drape made of sewn cotton and polyester, easier to handle than synthetic drapes, but require reprocessing after use. Woven drapes must be inspected for tears, holes, and fraying, and fabric is not waterproof. Pretty much, we don't use these anymore. It usually is the non-woven drapes. But anyway, again, here's where your incision site would go, your hole. This guy here, this orange guy, is called an ioban. And it has iodophores on it. And what it does is an extra barrier on the skin, and we cut right through it. This whole thing is sticky. Remember all the little germs we have and bacteria growing on our skin? This is just another extra layer of precaution, especially if we're cutting and going down into bone. We don't want nothing to get into that bone. These are our blue towels. The cloth surgical towel is soft, pliable, and very absorbent. Their primary use is in draping is to frame the incision site and create the base layer for the larger drape. The plastic towel are impervious, waterproof towels made of synthetic woven material, also used for the same purpose. Okay, so you see how it's cuffed. It's cuffed like by a fourth of an inch. And we would pass these to the surgeon. The first one, we'd walk around, give it to surgeon. This is where the surgeon would be right here. They would put it down, then we would pass the left, the right, and then the last one would be on our side, and the surgeon would put it on. And you notice how it's cuffed, and it will just go flat. Okay, it's another line of defense for sterile technique. This picture here is a picture of a plain sheet. There's no holes in it. There's nothing for incision site. We will use this for our first line of defense. They come in half or 3/4 or a full sheet. They're simple rectangles, used for general purpose again. And we'll show you these in a later video, a later slide, how these are used. This first one is like for an ear drape. You see it's really small and very little. So this is called an ear drape. This one here is called a U drape, and we would use this around extremities, the arms, the legs, right? Somehow we can't square off around arm or around leg, but we can use a U drape to wrap around. And then this is a split drape. I use split drapes a lot for around the neck, around the face, and come up, right? That way the face is just there for us to do cases, but the rest of the body is covered. Here's that great IOBAN again. The plastic incised drape is placed over the entire surgical site on top of the towels and any bottom sheets from the fenestration. So this is kind of going to be like our last thing that we're going to put on. Again, it is all sticky, all iodophore, and they come in long sheets. Some come in short, or you can just cut them to the length that the surgeon wants or you want. This guy here is called a stockinette, and we use that on our arms and our legs. It's an extra precaution. A lot of times, if we are working up on the knee area or this area, we will use the stockinette to wrap over the foot or wrap over our arms. Because when we prep, yes, we can prep in between all the fingers and the toes, but we also want to, we also kind of think it's kind of more germy, if you could say. And so we would cover that up and just have an extra precaution since we're going to work somewhere down in here. So this guy again is called stockinette. Hang in there with me. All right, so now let's get to how we're going to drape, okay? Placing the folded drapes. All drapes are fan folded. The folded drapes should be placed strategically so that it can be unfolded correctly in place. Here's the thing about drapes. They usually come and say, put left hand here, right hand here. They kind of give you steps. Sometimes they'll say 2 head and then 2 feet, and they'll have arrows. So it's kind of dummy proof, but you still have to read it and make sure you place it properly. Multi-layer draping, the order of the layer is standard, right? The first layer starts the incision site. The other layers extend to the periphery. So you can see here, this is where we're going to have surgery. So we would prep this whole area here if this is where we're going to do surgery. This is that full sheet, half sheet, 3/4 sheet, and it's going to come and lay straight down here. It gives us an extra barrier right here. Then we're going to towel off this area with our 4 towels, whether it be the sticky towels or our blue towels. Then we're going to use our laparotomy drape because look, it already has a square hole in it, and that's going to come on top of that. And then here is our IOBAN that's going to go over that. So there is 1, 2, 3, 4 layers of draping that we'll use for an abdominal case. Incised drape or IOBAN, same thing. So all disposed procedure drapes have instructions for correct orientation, right? Everything says where it needs to go. We just got to make sure we do it, and we do it in our work frame, which is from waist to neck. We don't want to drop our hands below anything or raise high. Visualize the drape as having 2 sides. One side is the direct contact with the patient non-sterile surface, and the other side contacts the sterile surface. So again, once you drop that drape, wherever it lands or wherever you put it, it has to stay there. We can't pick it back up and move it over because we missed a lot of the incision site. It doesn't work like that. We got to leave it like it is, or you got to take everything off, re-prep, re-drape. To protect gloved hands, grasp the edge of the sterile sheet and roll hands inward to form a cuff. So we would hold it and turn our hands this way, and the cuff would be around. And that way, even if someone would grab here, like say anesthesia grabbing the drape to hang up on their IV poles, even if they touch you, your hand is cuffed, and the outside or the inside is where it's non-sterile anyway, so it's okay.
All right, so first thing are the medium sheets or half sheets. So I'm going to bring my medium sheet up. I'm going to pass half of it to the surgeon. And we're going to drape the inferior patient. We're going to extend, make a cuff, and drop. Next medium sheet, I'm going to give to my surgeon. We're going to unfold it, extend it, make a cuff.
See, they're cuffing their hands
superiorly. Now, I like to do this first because it covers most of the patient and helps cut down on contamination. Next are the towels. We want to make sure that we've already prepared the towels ahead of time. We bring all four up at the same time. So my surgeon's going to grab the first towel and place it on their side. Next, we're going to go superiorly, or the top side. Inferiorly, or the bottom side. And then the last side is my side. Now, I always made sure that I was at least 12 to 18 inches away from the field. Even though I'm protected by a drape, I still don't want to risk contamination. So we have a pretty good squaring off right there. Our last drape is the laparotomy drape. Now, the great thing about drape manufacturers is they tell us exactly how to put this drape on the patient. So we can see our little man here telling us which way it goes. So I'm going to place this right at the incision site. We're going to unfold it. The surgeon is going to grab one side. I'm going to grab the other. We're going to cuff our hands and extend. Good.
and then they just drop it.
Unfold the drape.
They don't lower their arms or anything. They just drop it.
Cuff our hands again.
Watch them cuff, see?
And extend.
And then they just drop.
There we go.
He didn't go below his waist. Our surgeon is going to grab
the white paper for us. And there we have it. A complete and perfect patient draping for supine or prone position.
So the other thing that you need to be careful with is the stickies. They didn't do that for this demonstration, but always take the stickies off because that helps keep that drape in place during the case. There's a lot of things going on. There's the Bovie cord, there's a suction, there's us working on it, laps or Ratex up there. And if we don't have the stickies down on the patient, that drape tends to move. And then we're could create a non-sterile area while we're working. Handle drapes with little movement as possible. When draping, do not touch the patient's skin or any other non-sterile surface. After a drape has been placed, do not move it. Use only non-penetrating towel clamps for securing drapes. When drapes are stapled to the patient's skin, use an impervious plastic drape to cover the stapled area. So these guys here are non-penetrating clamps. And what that means is we have our 4 towels down, right? And we don't want them to move either. And so we would buckle up a little bit at the corners and put that clamp right here. We're not touching the patient that we prepped. And of course, the prep's probably further down. If we would put a clamp that goes through the towels, then the tips of those clamps are hitting the patient and possibly where the prep is not at. And that's what the Edna looks like, non-penetrating. It will not poke through. To pass 4 towel drapes, fold down the top edges about 4 inches. Present the first 3 folded towels by grasping the top corners with both hands and the folded sides facing away from the surgeon. So your first 3 are going to have their 4 inches facing you, the surgeon tech. Your last one's going to be facing the surgeon because he or she's going to be draping the last one on your side and just going straight down with it. And we'll see it on this video.
Next are the towels. We want to make sure that we've already prepared the towels ahead of time. We bring all 4 up at the same time. So my surgeon's going to grab the first towel and place it on their side. Next, we're going to go superiorly for the top side. Inferiorly.
So you see how the 4 inches is facing the surgeon.
For the bottom side. And then the last side is my side. Now, I always made sure that I was at least 12 to 18 inches away from the field. Even though I'm protected by a drape, I still don't want to risk contamination. So we have a pretty good squaring off right there.
Sorry, guys. Adhesive towels are usually passed with the adhesive side facing away from the surgeon so you can peel away the backing exposed adhesive drapes. Yes, most surgeons want it to be ready to rock and roll. So you would lay out your 4 towels with the sticky on your back table, right on top of each other, and peel off the sticky. And hurry up and pass one at a time, get back to your table, grab another one and another one. That saves time in the long run, and your surgeon isn't there tapping his or her foot saying, come on, we're just draping. All right, move around the table instead of reaching over the prep site. So if I was passing to the surgeon, I would literally grab my 4 sets of towels, take one around, pass, get back over here. And then you can pass, and the last one would be on your side, if that makes sense. And we can go over it again later. When in place, the portion of the drape that is below the edge of the operating table is considered contaminated. The edges are considered non-sterile. Basically, anything below your waistline is considered contaminated. So from here all the way down and on the table, from here all the way down is considered contaminated. Matter of fact, right here is not sterile. Your back is not sterile, right? Anything you can't see is not sterile. Your sterile area is from your neck to your waist. Use only impervious drapes on areas likely to become soaked during surgery to prevent strike-through contamination. There's going to be saline up there. If you're doing an orthopedic case and it's an arthroscope case, there's going to be tons of water because somehow we have to blow that joint up, and we do it with water. So whatever comes in must come out. Aluminum coated drapes are used in laser surgery. Plan ahead for draping. Stacked drapes have extra sterile towels and sheets available. So when you're setting up the case and you are getting your towels and your drapes ready, you would go bottom to top. In other words, your last drape would be on the table first, right? Then your towels, right? Whatever comes, whatever. So whatever you pass off first should be the first thing. So here we go. Draping a microscope. These things are a little hard to do sometimes. Large equipment such as the operating microscope, C-arm, and robotic components used within the sterile field are draped before surgery, right? You don't want to have the patient on the table under anesthesia, the surgeon ready to use this equipment, and it's not draped. Most equipment drapes are designed to fit with cutouts and ample material to allow smooth draping. The circulator assists during the equipment draping by grasping the non-sterile edges of the drape and pulling it into place. I'm going to show you how to drape a microscope.
Before draping the microscope, make sure the binocular tubes are configured in the correct position and check that the balancing has been done properly. The non-sterile nurse should open the drape for the scrub nurse. Grab the drape with the hand picture facing you. Unfold the drape, first to the left and then to the right. The instructions must be upright and facing you. You will find several rubber bands. Detach them and keep them with you, as they will later be useful to help secure the drape. Find the hand sticker and slide your hand inside the drape to find the lens cover. Hold the tab containing the white dot with your thumb, and the other tab with your index finger. Lift the lens cover at the same time as the remaining drape. Match the white dot on the lens cover with the black dot on the microscope, and twist to the right until you feel it is secure and locked into place. Move the drape over the microscope head and pull it over the rest of the arm. Your circulator can assist you, pulling the drape from inside over the microscope arm and wrapping the last band. It's now time to drape the eyepieces. The drape has several eyepiece covers. Choose the middle one from the three facing you to drape the surgeon's eyepiece. Then use the other ones depending on the number of eyepieces to be draped. Be careful, the eyepiece drapes are perforated at their end. It is important to be gentle in order to avoid any detachment. Secure the drape using the Velcro straps. Put the remaining drape inside the empty space. Make sure the drape is not covering the lens. Wrap the bands around the microscope head and arm, placing them taped to tape and not taped to plastic, and making sure the drape is fitted airtight to the microscope. Check that the straps are attached around the microscope head and around the arm as shown in the images. Choose the option that best suits your surgical practice. If necessary, the rubber bands can be used to keep the drape tighter to the handles and the main surgeon and assistant binocular tubes. If your microscope is equipped with SMARS, the circulating nurse will press the SMARS button. This will activate the pump to extract the air from under the drape. Rotate the microscope to ensure that it can be moved easily in all directions. The drape shouldn't interfere with microscope movement. You are now ready to work with the Leica microscope.
So a microscope is it's hard. It's definitely hard to do, but it's doable. The circulators definitely can help you uh from the inside of the drape, right? Not the outside, the inside. They can reach in and help pull back and over. They can definitely help you do a lot of different things. So let me get this back going. Most equipment like the microscope or C-arm, whatever brand it is, that company usually has drapes made for their scopes or their C-arms. So it's not like a universal scope thing. Each company has their own drapes. I'm going to show you how to drape a C-arm as well before we go on. Here we go.
It's your boy, the Surgical Guru. We're back with another video. I'm going to need y'all to use your imagination. This is my back table. That's the drape on the back table. And then we have a C-arm drape. So what we're going to learn today is how to put a C-arm drape onto a C-arm. All right. So at the table is where we usually open up the drape. just so that it can stay sterile. I like to, if you zoom in right here, you can see it says left hand here. And it says right hand over here. I want to flip this around so it's facing me, because that's where my hands are going to go. And you want to make sure that when you open it, these strings are on the outside of the drape. So it looks like it's going to go. Looks like it's going to go like that. Okay? So pick it up. You don't want to hang it, so you kind of bring it together like that. All right. And once you get to the C-arm, you can kind of open it up. The hole faces the C-arm. You don't want to let your face get too close because you don't want to contaminate the bit. But you keep your hands protected. Kind of. Alright. And you take these tabs, break them, and there's stickies on them. That. You can hold on to it. And just kind of bring it around the drape and stick it to itself. Just remembering to be aware of where your body is. You don't want to get it too close to the C-arm drape and contaminate it. So same thing here. Don't throw these on the floor. Your nurse is going to hate you. You don't want your nurse to hate you. Boom, boom. Stick this one to itself. Now there's also stickies here. Take that, stick it to itself. And up here. Do the same thing. Well, that's about it. How to drape a C-arm with a C-arm drape. Let's go!
He's funny. Okay, and so there's another one with the Da Vinci robot and draping, and so let's just get that out of the way too, so you can see the difference.
Hey guys, welcome back to another Surgical Tech Tips. We are still draping the robotic arms, and we're going to be talking specifics to everything about these arms, how to control them, how to dock them. Let's get going. All right, so first off, we're going to be talking about how to move these arms specifically, and also move the boom from the field. Sometimes when the nurse is driving the robot in over the patient, you need to move or rotate the boom. She can do it. She or he can do it from the back of the console, but sometimes it's just easier for the people that are scrubbed in to just rotate the boom as the nurse is pushing it in, getting ready to dock it. So we have a button right here on the back of this arm shoulder. I like to call it the shoulder. I like to call this the elbow, and this is kind of like the hand. So if we hit this button and hold it itself. Now we have two more buttons that are attached to each of these arms. We have one button here at the bottom of the hand, I like to say, and that's going to move side to side, up and down. And a button up here that's going to angle left, right, forward, and backward. All movement directly from the elbow here. This movement is coming back from this. One other use for this back button is holding it down and pulling the arm all the way down. You'll notice it's red right here, and that's going to enable the sterile person to lower the boom or the boom, all by the touch of that button. I've got one more button to talk about on this arm. It's located on the back side. Remember, we have our two buttons here, one here, but there's also a button directly on the back side of the arm. And this button is specifically for patient clearance. If after you dock your robot and you have all your instruments in place and the surgeon's moving around and working on the case, and you notice that these arms are getting close to the patient, you can use this patient clearance button to move an arm out of the way to make sure that you have enough clearance so it's not going to be harming the patient. Now, what's new with the XI, which is pretty cool, is the fact that you can just grab it and you can move it yourself in all of these directions. I feel like that's a little bit more too much brute force than I'm used to. So I do still use the buttons because it's fine movements and it's easier to dock these arms with fine movements rather than just taking the whole thing and trying to, put it into the trocar this way. Much easier with fine movements with the buttons. Now, I don't know if you've noticed these yet, but there's a whole bunch of weird little red dots up on the top of these arms. These are actually magnets, and these are for draping purposes. The drape that we're going to be using is basically a big clear plastic drape. It's going to go over the arm, all the way up the arm, and there's two little magnets that you're holding onto underneath the drape that you just snap in place on each of these magnet holes here. So when looking at this robot, you would think you have 1, 2, 3, 4 drapes that you need to drape with. That's not the case. We have a magnet right back here. And this is the column drape. It's important that you put the column drape on first. Always put the column drape on first. So I'm sorry, but I don't have a sterile setup that I can use with this, but I do have some extra robotic drapes. So I'm going to drape out the column drape first. Now, obviously, I'm just doing it with my bare hands, so you're going to kind of have to use your imagination a little bit.
There's nothing more powerful than you making your thing happen. Really going for it. Doing business on your terms.
Column drape when you get it on your table. We're just going to open it up. Just like that. And this is our magnet. This is the magnet that I was talking about that it's going to attach to on the column or vice versa on the arms when we get the arm drapes. So you want to make sure that this is away from you. And I'm just going to place this right on the column. Hands are touching the outsides of the drapes. This already has, a formation of a square to be able to go right onto that tower. So I just like to hold right underneath those, put it right there on the magnet. I'm holding the outside of the drape, and you're just going to tear the tapes, pull the drape down, always handling the outside, or the outside of the drape itself. That's the tower drape. Next is going to be our arm drape. Our arm drape it's much easier on this console, or on this robot than it was on the SI. You're basically going to start over this arm and move up, move up, move up, move up, move up, until you get to the magnets, and just put the magnets in place. This is the arm drape as you're going to get it right out of the package on your field. So it's on your sterile field. Pop this tape open and fold it out. You want to make sure this piece and this piece are facing forward when you drape this. So I like to put obviously this is my hand, but sterile hand, and I like to grab both of these plastic pieces together and go directly over the arm like this. Starting it on the outside and kind of dropping it and draping it over the arm itself. Next thing you need to do is you'll notice that on the drape, we have two little hands. We have a hand here, we have a hand here with our magnets above each hand. That's telling you that you need to take both of your hands and slide them in these cuffs. You're going to then pull the drape all the way up the arm and attach the magnet pedal. It's as simple as that. Kind of pull some of the slack out. We're going to undo this tape, bring this down a little bit. Now we will attach our top plastic piece and our bottom plastic piece. It's very, very important to note that you do not get any excess drapes underneath these plastic pieces. If you do, you'll probably have a fault. It won't dock right. It won't accept an instrument correctly. It's just not good. I will take these little malleable things and I will just press them backwards to keep this drape smooth and out of the way. So it's easy to insert the instruments directly into the trocars. If this is out like this and you go to insert an instrument, you might accidentally puncture this drape and completely contaminate the instrument itself and the case. So take these malleable little plastic pieces and just push them back into the arm to keep that drape out of the way. Last part of this draping is this plastic piece that's on the back side of the drape. It's just going to slide and clamp in. Remember, try to keep the plastic out of the way. And it's just going to clamp in place to try and keep some of that slack out of the drape itself and keep it down instead of, bunched up over where you're going to be inserting instruments. All right, I think I'm going to end this video here. We went over the draping and specifics of the arms themselves.
I know that looked like a lot. You're probably like, wow. It's really not that bad. And once you start doing those cases, it'll get really easy for you. All right. So, common surgical site draping, say abdomen. Draping the abdomen is the most basic technique and can be used to drape many other surgical sites, including the back, the flank, and the thorax. This is what it's a laparotomy drape right here. This goes over basically the entire patient. This part here would be up over the head. Anesthesia would put these corners up on some IV poles. This is where the abdomen area would be. Whether the patient is got their arms out or next to their sides on their arm board, this will cover everything and the arm board itself. So you would have a half, 3/4, or a full plain sheet. You would drape with 4 towels. You would do your laparotomy, again with the arm boards, and then your aisle band would go over that, and then you would make your incision. So this here, as you can see, this is what the half sheet or full sheet would look like. And what they're doing, they're draping from waist down. Look at their arms. They're out to the side and they're just going to drop. They're not going to raise their arms down. They're just going to drop it. And then now they're toweling off. After they're toweling off, they are putting the aisle band on, which is fine. And then they're working together to put the laparotomy drape on. Look where this arm board is. This is not sterile, right? So you got to be careful not to touch that. You have to be 12 inches away from there. Once you get the laparotomy drape open, you do feet first. See, look how long this drape is. And then you do head next, and they both have their hands cuffed, and you see anesthesia back here, or this is where anesthesia would be. And if they would grab here or on the hand, they're not contaminating you because this is the underneath side, the non-sterile part. And then once that is taken by the anesthesia, you just drop your drape. You can walk away. Always keeping your hands and arms at waist level, no higher than pretty much your neck. And then here, they take the white piece of paper out, and we're ready to start the case. Lithotomy or perineal draping is used for GYN or transperineal surgery of the prostate and combined abdominal perineal resection of the colon. So the materials for this would be plastic towel drape for perineum, the under buttocks fluid pouch drape, legging drapes, towel drapes, top sheet, and then your double fenestrated drape for the abdomen. So this is what the under buttocks drape looks like. This part goes right underneath the under buttocks. There should be a cuff in here where your hands sit in there and you can go underneath the buttocks and still protect your gloved hands. And then this is a bag where the fluids can go in. And this guy here is where we hook up suction, and then the suction hose will go to the canister for any fluids that get in there. If we didn't have this suction, then this pouch and bag would just fill up with fluid and then get really heavy and probably pull the drape out. This here is a perineal drape. Again, same concept. This time it's got a hole in there for where you're going to be working at. It's all one drape. And then, of course, your leggings. And this is how the feet would sit in there in the legs. Here's lithotomy draping.
Drape completely under the buttocks, so the only one I actually like is placing the leggings first. Now, the reason I like the idea of placing the leggings first is because I've seen many techs use the under buttocks drape first, and I've seen most of them contaminate themselves on the stirrups. Years ago, when we used candy cane stirrups, when they were common, it wasn't such a big deal because the leg was more vertical and out of the way. But now with adjustable stirrups being utilized, it's far easier to contaminate your gown. So I think leggings should go first, but I'm going to put the under buttocks drape first. So manufacturers continue to do a great job for us by telling us where to place our hands. So with my hands underneath the cuff of the under buttocks drape, I'm going to place the drape completely under the buttocks so that only the cuff is barely visible underneath the patient. I'm going to be sure to be very careful and make sure that I am careful not to contaminate my sleeves on the stirrups. So I've got the under buttocks drape. It says left hand and right hand. How amazing is that? I'm going to let the drape completely fall. Left hand, right hand. I'm going to be careful not to contaminate, and I'm going to push it under the patient. There you go. Next, we're going to grab 2 towels that have been prepared ahead of time, and we're going to outline the surgical site. One drape to my surgeon. One drape for me. All right. Now, the great thing is that the companies and the manufacturers that make these drapes make it as easy as possible. They are kind enough to label the direction of the drape, the side it's supposed to be on, and oftentimes the anatomy it covers. So here we see on the leggings, it says left hand under the cuff and toe. So I'm going to go ahead and follow those directions and put my left hand under the cuff. I'm also going to grab my right hand on the toe and let the drape drop. Now, it is incredibly easy to not put this drape on correctly. So we want to start initially really, really well and take our time at the beginning so that we're sure to cover the whole stirrup. So with the toe in my right hand, I'm going to go under the cuff and try and create an opening. Then I'm going to slowly put the drape onto the stirrup, staying behind the cuff and pulling the toe. Again, this is not easy, but I'm going to extend it onto the patient just like that. The next drape, again, left hand under the cuff and toe. So I'm going to put my hand there, grab the toe. I'm going to continue to put my right hand under. And again, it's important to go slow and stay behind the cuff so that we get it completely on the stirrup and we don't contaminate. There we have it. Not too shabby. Now, when I think the stirrups are completely covered and I've extended the drapes on there, I'm going to go ahead and start and put a medium sheet on the patient. We're going to make a cuff and drop. And then lastly, we have the fenestrated drape. Again, I only have a laparotomy drape, but there are other drapes out there that will completely cover the patient. Patient's head, patient's body. I'm going to put the hole right in the incision site, extend it to my surgeon. We're going to create a cuff. Down, completely extend the drape, create a cuff, and go forward. And there we have, folks, a completely draped patient in lithotomy position.
So the most important thing that you need to remember is where you're at, what's next to you, so you do not contaminate. Again, if you put this drape in first, there's nothing on these legs that are protecting you. So if you rub against them, you know, you may need to get a sterile sleeve to put on, or you may have to totally regown and reglove. You have to be in your surroundings. You have to know what's around you.
Drape completely.
So again, they're doing the leggings here. Looks like they may have the buttocks drape. They're doing the half sheet. They're doing the laparotomy drape or the perineal drape and draping it down. And then now they're ready to go. They got their towel up here. They're probably gonna put some instruments right there. The surgeon will probably put some instruments right there as they're working. This picture here is a picture of a knee case. Looks like we're going to do a total here, just the way it's draped out. And I see the line, we're going to go from here to here to open the patient up. The leg, knee may be draped to expose only the upper or lower areas. The hip may be draped to expose only the acetabellum. That's your socket, that's your hip, and a wide area around it. The foot is normally excluded from draping. It is enveloped with towels or impervious tube stockinette and wrapped with adhesive drape. So basically, you're going to have a bottom drape, probably a half sheet or something underneath here. Impervious tube stockinette, which is underneath this Coban. So what they did after they prepped, they put the Coban over, slid it around, stopped about right here, and then took some Coban and wrapped it so the stockinette wouldn't slide down or move. Then the surgical towel would also be up here where you cannot see, but it's covering the tourniquet. And then a split drape, which covers also the tourniquet and comes up and around. It's just an extra barrier so we don't contaminate. And then the fenestrated top sheet or a legging, which comes with a round hole in it. You put the foot through there and you wheel it up. It's a very big long drape. That's what this guy is. So half of it comes down off the end of the table, and then the other half comes up to anesthesia, and then you have your working area right here, and all the way around the leg. This case is a shoulder draping. This patient is sitting in a beach chair, slight beach chair format. This here again is the shoulder. We are using the extremity drape, round hole. The arm has got a stockinette on it. You can see the blue. This is Coban wrapped around. Okay. Then your IO band is over it. Ready to cut. And then you have a little bit of a working space here where you can put your bovie and stuff on the patient. And then you are standing out here somewhere with your Mayo stand and back table to pass instruments. This is a hand case. As you can see, they're just using one arm board instead of an arm table, which is about this big. Okay. Here's your tourniquet. So you would put maybe a half sheet, something very small on this arm table while the hand is being held up by the circulator. The arm is totally and hands are prepped. You put the towel around the tourniquet. You would put a U drape over this hand table or this arm board up around because it's sticky and it will cover the sterile towel. Then you would take your extremity drape and you would take the hand away from the circulator holding it, and you would bring this up over, and then the rest of the drape will go up over the body and over the face, giving it to anesthesia so they can hang it up on the IV pole, and then you're ready to work on the hand. If we were going to work up here more on the elbow, you would put a stockinette over the hand up to about right here, co-band it a little past so it doesn't slide off during the case. I know it's a lot to take in. Once we start doing exercises with draping, you'll see it's not that bad. It just sounds like a lot. Draping for the arm or hand using traction and also C-arm. As you can see, everything from here is non-sterile on the C-arm, especially up underneath the table. You can see the C-arm top is draped. The arm is draped out with all the drapes, U-drapes, extremity drape, and you can see how the extremity drape is being held and how big it is by anesthesia. Anesthesia is right here because the patient's head is right here. This is a rolled towel with some co-band on it to help give some lever on the wrist because we're probably working up here on the hands. If not, it'd be flat on the table. The surgeon would be sitting over here. We may or may not be over here and have to move in and out of the way when we bring C-arm in. If the C-arm is going to be standing right here the whole time, then we'll either be on this side or right next to the surgeon, helping with instrumentation and holding instruments. Here's draping of the hand.
Now, our first step is to put a medium sheet over the hand table or the arm board. It's not important to have the surgeon help because I think it's a pretty cramped spacing. So I'm going to go ahead and put the medium sheet down, making sure I create a cuff and that I don't contaminate my hands. The next step is to give the surgeon the stockinette. They're going to grab the hand so that the circulator can get out of the picture. Got it. And we're going to completely unroll the stockinette to over the tourniquet, making sure that we stay on top and under the cuff of the tourniquet. Of course, I like to try and get it completely over the tourniquet just to get that completely covered and out of the way. While the surgeon has a hold of the arm, I'm going to go ahead and grab the U-drape. Now, I didn't have a plastic U-drape in the lab, so I'm actually going to use a fenestrated U-drape, but just know that it would be one of the plastic ones. I'm going to go ahead and set it down. I'm going to get rid of the tape. And I'm going to place the U-drape in front of the tourniquet. Awesome. At this point, the surgeon could put the hand down. All right, then lastly, we have the extremity drape. Manufacturers have done a great job with all these fenestrated drapes. They tell us which way to go for the feet. Oftentimes, they have a little person on them to show you where to place it on the patient. So I'm going to go ahead and put my hand in the hole. Grab this, please. And pull the arm through the extremity hole all the way up to the tourniquet. I'm going to unfold, drop it. I'm going to create a cuff, hold that for me. And I'm going to extend the drape down, covering the patient's legs. I'm going to do the same for the patient's head. And that's it. Hooray!
So you're probably asking, so how do we do surgery on this hand when it's all covered up? Well, once we get all the blood out, right, we will cut the drape where we're going to be working at. That's how that happens.
Now,
All right. So today what we covered was techniques of surgical draping, maintaining asepsis during draping, and techniques of the surgical site. Draping techniques of the surgical site. Again, remember that you cannot drop your hands below your waist. So when you're draping, you have to cuff, pull out, and just drop. Okay. We're used to, like, when we throw away something in the trash can, we drop our hands and throw it at the same time. We don't do that here. We will just pull out, drop, right? We're not throwing, we're not coming down and letting go. We're just dropping. Stop sharing here. We will go back over anything that you have questions about next class. Again, you'll get time to drape and exercises to drape. So we'll go over that then. You guys have a great evening.